after 3 months of testing, and we got the diagnosis he had very early Alzheimer's disease.
The day her husband and lifelong partner Aldo was diagnosed is a day Dolores Bertolini will never forget.
With his personality, Aldo decided that was not a good diagnosis, and he was not going to even address it, and it would go away.
But experts advise being proactive. One way to stay independent longer is to keep the body active. Animal testing shows a connection between exercise and the brain.
The animal studies where animals are exercised show that the number of new nerve cells formed in the brain when there's regular exercise is 4 times the number that are formed in the brain without exercise.
Preliminary research is showing much the same in humans, that staying physically fit may slow brain shrinkage. The exercise doesn't need to be strenuous. Anything aerobic, even a daily walk, is enough to get your heart pumping, increase blood flow, and promote new cell growth.
So if you want to stay at home longer, then physical exercise slows the memory loss by generating new nerve cells, making the cells that are there healthier.
And it's not just the body that could use a workout.
By adding the brain exercises, especially the processing speed and reasoning, and retraining yourself and how to use your brain more efficiently through the memory techniques, you're able to slow down the impact on your function.
It's well known staying fit helps older adults without dementia offset cognitive decline. The hope is it can boost the brain of Alzheimer's patients too. For Lee Memorial Health System, I'm Amy Osher.
Hi, my name is Rachel, and today we're going to be talking about the effects of aerobic exercise on Alzheimer's disease. Just a brief reason why I chose this as my presentation was that there are members of my family who have a history of Alzheimer's disease, so I was interested to see some of the factors that may influence someone developing Alzheimer's disease, and also if there are ways to prevent or slow it from happening. So today we're going to talk about what Alzheimer's is, some background information on it, different treatments that are available for individuals who have Alzheimer's disease, ways that we could possibly slow the progression of Alzheimer's, benefits of exercise and how they play a role in slowing the progression, and then we're also going to talk about a couple different studies that have evaluated aerobic exercise on Alzheimer's disease. So just a brief definition, Alzheimer's disease is a type of dementia that causes problems with your memory, thinking, movement, language, and behavior. It, on a more physiological term, is basically an impairment of your neurons and synapses that will block cell-to-cell information. There's a couple of facts that I thought were interesting about Alzheimer's disease. Alzheimer's is the 6th leading cause of death in the US, and it's the only cause of death in the top 10 in the US that can't be prevented, cured, or slowed. 1 in 3 seniors will die with Alzheimer's disease or another form of dementia, and it's actually not a normal part of aging. And almost 2/3 of Americans with Alzheimer's are women compared to men. Alzheimer's disease and other dementias also cost the US a lot of money. In 2015, it was estimated that it would cost the US $226 billion. And this is due to research that people are doing and long-term care facilities that are having to take in patients with Alzheimer's. There are a couple different risk factors and causes for Alzheimer's disease. One of them is age. So as individuals get older, that increases their chances of developing Alzheimer's. Also, family history will play a role in the development of Alzheimer's. If you have a parent, brother, sister, or any family member that has had it or had a history of it, it will increase your chances of developing it later on. Their genetics play a role in Alzheimer's as well. So there's 2 different types of genes. We have the risk genes and the deterministic genes. In risk genes, it will increase the likelihood of you developing Alzheimer's, but it won't guarantee it from happening. The gene that's associated with Alzheimer's disease is the apolipoprotein E4, also known as ApoE4. There are different branches of this protein, and parents will transfer them onto their children, but it's only the E4 strand that can increase your risk of developing Alzheimer's. The deterministic genes will guarantee that anyone who inherits them will develop the disorder, and this results from a gene coding of 3 proteins. That's the amyloid protein precursor, presenilin 1, and presenilin 2. And many families of different generations can be affected by the deterministic genes. Smoking and alcohol consumption will increase your risk of developing Alzheimer's, as well as physical inactivity. One of the most prominent risk factors is actually physical inactivity for dementia, and a study by Norton et al. Found that 12.7% and 20.3% of Alzheimer's disease cases in the world were attributed by physical inactivity. There are a couple different signs and symptoms that you can notice as an individual maybe develops Alzheimer's disease, and that can be memory loss, difficulty in planning and problem solving. You'll have confusion with time or place. You'll have difficulty understanding. There'll be problems with misplacing things and losing things. You'll start to feel withdrawn from social activities, and there'll also be changes in mood and personality. There are a couple different things that can detect Alzheimer's disease, and the earlier you're able to diagnose Alzheimer's disease will allow more time to put in a treatment plan. So people can look at health history, they'll look at different brain imaging, MRI, PET scans, CT scans to detect changes in brain volume, and there will also a variety of surveys and questionnaires. Alzheimer's doesn't develop all at once, but rather in stages. There's 3 different stages associated with Alzheimer's. You have your mild stage, which is your early stage, and this, you're still able to live independently. You possibly can drive and engage in social activities. Some of the things that start to happen are difficulty coming up with the right word, forgetting names of people you've just met, and losing and misplacing things frequently. In the moderate or middle stage, it's typically the longest lasting stage. It can last anywhere from 1 year to 20 years. And for this stage, you'll start to notice confusion with the date. You'll begin to forget your own phone number and address. And there'll also be changes in behavior, such as saying things over repetitively and becoming moody. In the severe to late stage, you'll no longer be able to live independently, carry on conversations, and you'll start to experience changes in physical abilities such as walking, sitting, and swallowing. We're going to talk a little bit about the Alzheimer's brain and compare the Alzheimer's brain to a normal healthy brain. So in an Alzheimer's brain, it results from the dying of brain nerve cells, and it can be visualized by enlarged ventricles. So here we have a normal brain, and to the right of it, the enlarged ventricles are the dark blue areas. And you'll also notice that the cortex around the brain starts to shrink and shrivel up, and this is associated with areas of thinking, planning, remembering. The hippocampus is also greatly affected by Alzheimer's disease, and that plays a key role in the formation of new memories. On a more microscopic level, we'll look at amyloid plaques and neurofibrillary tangles. Amyloid plaques block nerve cells in the brain. And what occurs normally in a healthy brain, we do have the amyloid protein, but we're able to break it down. And in an Alzheimer's brain, you're not able to break down the amyloid plaques, and it results in blocking nerve cells. So right here we have an example of an amyloid plaque buildup. And the neurofibrillary tangles are kind of twisted. They are twisted fibers that block nutrient transport from one part of a nerve cell to another, and that can be noticed here. And you can compare the Alzheimer's cells to the healthy cells. And as Alzheimer's progresses, the plaques and tangles progress to more areas of the brain, affecting it more greatly. Right now, the treatments for Alzheimer's disease are medications and herbal remedies and supplements. Medications basically just prevent or reduce some of the side effects of Alzheimer's disease, such as behavior and moodiness. However, it doesn't slow it down from occurring. Also, herbal remedies and supplements, such as coconut oil, have been suggested to minimize the side effects of Alzheimer's disease. However, there's not really a lot of scientific evidence backing this up, and it's more word of mouth that people have said that's worked for them. We have some different ways to slow Alzheimer's disease, and they're mainly due to exercise and diet. So some of these would be keeping glucose levels under control, maintaining healthy cholesterol levels, exercising on a regular basis. If you're a smoker or drinker, it's best to quit smoking and to moderate alcohol consumption. It's also important to engage the mind in intellectually stimulating activities. So we all know that exercise is good for us. It improves our cardiovascular health, it increases our bone mineral density, and it can decrease the risk for many diseases. Another thing that people may know, and a lot of research has recently shown, that exercise can enhance and protect brain function. So we're going to review 3 studies today, and they basically talk about how exercise affects our brain volume, neurogenesis, so the formation of new neurons in the brain, and brain-derived neurotrophic hormone, which is a growth hormone. So for the first study, it's by Colcomb et al. It examined whether an aerobic exercise training program increased brain volume in areas with age-related decline in older humans. The study looked at 59 participants that were between the ages of 60 to 79 years old, and then they had a younger control group of 20 participants between the ages of 18 to 30. The study took place over a 6-month period, and the older adults were separated into 2 groups, an aerobic group and a non-aerobic group, which consisted of stretching and toning. As the 6-month period progressed, and exercise intensity increased for both groups. The participants participated in 3 one-hour sessions per week. Also, before the study started, 1 week prior to the study, MRI brain scans were taken, and then post-exercise study, there was another MRI images that were taken. What they found was that the aerobic training group had an increase in both gray matter and white matter in the brain, while the non-aerobic group didn't see any changes in brain volume. So we have a figure to look at here. The areas that are in blue are the gray matter areas of the brain that significantly increased after the aerobic exercise intervention. And the yellow areas here on the brain are the white matter areas that significantly increased after the exercise training. Both regions, the gray matter and the white matter, are in the prefrontal and temporal cortices of the brain, which are often reported to show substantial age-related deterioration. The next study we're going to look at deals with mice, and it investigated whether volunteer wheel running would benefit mice that were sedentary. So they had 15 young mice and 18 old mice. They were split into a young sedentary, young running, old sedentary, and old running group. And the way that they tested them for spatial learning was through a Morris water maze, which is basically putting these mice in this little swimming pool and dropping them in different locations, and then the mice would have to find their way from different locations to this platform that was hidden under the water, and they'd have to escape. So they timed them pre-exercise and post-exercise to see if they learned more from voluntary wheel running. So what they found out was that age runners showed faster acquisition and better retention of the maze than the age-matched controls, and that learning and hippocampal neurogenesis enhanced in the age-running mice compared to the sedentary mice of the younger and older groups. The final study we're going to look at today looks to examine how BDNF, or brain-derived neurotrophic factor levels, in the brain are affected by aerobic exercise. So as we age, BDNF has been shown to decrease, and BDNF also plays a very important role in repairing neurons, enhancing learning, and it aids in memory. There were 90 participants for this study, and they monitored their progression through an exercise program and a non-exercise program over the course of a year. 1 week prior to beginning the exercise program, there were blood samples drawn, an MRI was given, and fitness assessments were determined. What they found was that there was no significant difference between any of the tests at baseline, which was expected, but as the aerobic exercise group continued to exercise and increase intensity throughout the year, BDNF levels actually improved significantly, specifically for people over the age of 70. And actually, in the non-aerobic stretching and toning group, BDNF levels had decreased, which I thought was interesting. A limitation to the study would have been that the BDNF levels were tested through blood serum rather than brain tissue, which wouldn't be very ethical in humans compared to mice. So here we just have a diagram on stretching and toning group versus the walking group, and we can examine pre-serum BDNF levels to post-serum BDNF levels. So if individuals were less than 65, there was a slight increase, but not significant increase in BDNF levels, and if they were greater than 65 years old, there's actually a significant decrease in BDNF levels after the stretching and toning group. In the walking group, we can see that there wasn't a significant difference for people under the age of 65, but there was quite a huge difference between if you're over the 65 years old, you had more BDNF activities in the brain. In summary, aerobic exercise appears to be the best method of training program to increase neurogenesis, and it can also aid in the prevention of Alzheimer's disease and even slow the progression. A limitation in most of these studies that had in common was that they all looked at healthy individuals or animals. What we found was that out of the 3 studies, there was not a lot of improvement with non-aerobic exercise. However, it would increase functional capacity and improve balance and strengthening, even though it wouldn't enhance brain function. We can use this information to apply to an elderly population that's at risk for Alzheimer's disease or currently has it, to have them walking. It's an easy activity. If they're already mobile, they can participate in this regularly, and maybe aerobic exercise could be an alternative method to pharmacotherapies. Other areas that I thought might be interesting to investigate later on might be combining social tasks with aerobic exercise, so going for a walk, talking to a friend, things like that. It'd be interesting to investigate more why non-aerobic exercise interventions didn't have an influence on brain volume, and also if you're physically active throughout life, maybe that would prevent or slow down the progression of Alzheimer's disease as we age. Also, as I mentioned at the beginning of the study, women tended to have an increased risk than men to Alzheimer's disease, so it might be interesting to investigate why the reasoning is behind that. Thank you for listening to me today, and here are my references. Okay.